The goal today is, since we can't necessarily be in front of everyone with hands-on, bring you a treadmill and let you test it out and see all its capabilities, we thought we would try to do as live a virtual in-service as we can and leave time for questions and answers that we can discuss live, answer right on this in-service. We will be sending out a recording, so if there's any parts that you missed or you want to see again, we'll definitely send this out. This is only the first of hopefully many. So today we'll cover the basics features, benefits of simple aspects of the machine, the software, getting in, getting out, putting the shorts on and such, and then we can do some future ones that go a little bit deeper into some deeper content. So again, my name is Deb Soares. I'm the Clinical and Marketing Director at AlterG, and we have a group of people with us today that are going to help make this possible. So let's get started. We've got the anti-gravity treadmill here, the VIA. This is the model, the VIA model. We also have a Fit and a Pro model. The differences with the models, the Fit and the VIA, the frame is the same. The biggest difference are the capabilities in software, whether or not you have gait analysis software, reverse function, incline, speed. We have the ability to kind of alter those, so it can really kind of fit the needs of your clinic and your patient population. Some other features we'll go over: the ability to have some live video monitoring capabilities, and like we said, the gait analysis software. So we'll try to go over all those pieces today. Really want to just spend a little bit of time talking about who the AlterG really is best used for. And this is a big topic. We can probably spend an hour just going over this because the range of patients, patient population, and diagnoses that we can use the AlterG effectively with are many. So it tends to be thought of course, in the orthopedic world, right? We know that by reducing body weight, we can protect healing tissues, whether it be post-injury, post-surgery. We know that we can encourage early mobility, encourage better range of motion without increasing inflammation or re-injuring an area that's in the process of healing. So with that early mobility, we can decrease swelling, we can get earlier movement, decrease the chance for compensatory gait patterns. The possibilities are endless when we speak of early mobility. So that is kind of the easy application of the treadmill. That's why we see it used in so many orthopedic settings, whether it be from an ACL injury, ACL repair, Achilles injuries, or status post joint replacement, whether it be knee or hip. These are some of the most common uses of the AlterG. But another way to think about it is simply if you had somebody who just has pain and reducing that body weight, increasing body weight support, reducing the load on and stress on the joints, if they had decreased pain, what would they do with that? So most of our patients would just be able to walk for longer periods of time. They would be able to start working on more cardiovascular conditioning if they were able to walk without pain. They might be able to start the journey to weight loss. So really, when you really start thinking about all your patients and who is really limited simply by pain when they're trying to move, that could be the perfect patient to put on the treadmill, simply to start exercise, to have an entry point into exercise. Excuse me. Another way to think about it is the time to exertion. So if we remove some body weight, if we have that body weight support, it allows us to not achieve levels of exertion as quickly. We know that the treadmill is safe for cardiovascular conditions. We know that there's no negative effects of the body weight support, of the positive pressure that the treadmill provides on the cardiovascular system. So what this allows you to do is simply delay the time to exhaustion or exertion. So if somebody is deconditioned, has cardiopulmonary issues, and exercise is hard for them, but it's important that they start to engage in more cardiovascular activities, the treadmill can be a great entryway for that. Again, it could be a weight loss journey. It could be someone recovering from a prolonged hospitalization or a respiratory issue. But the treadmill sometimes gets forgotten about, and its ease of use simply to start enabling more mobility and enable patients to start working on endurance. I always like to say that working on endurance, mobility, and strength are kind of all together, right? You can't work on mobility without increasing endurance, and you really don't work on increasing endurance without building strength, which leads to better mobility. So the treadmill allows you to work on all of those components, again, for a wide variety of patient populations. The other avenue that the treadmill definitely fits into is simply sports performance. So you can do higher level activities, whether it be exercises, simple running, working on running mechanics, but at a higher level than you could over grounds while protecting your joints. And this allows us to work on performance training with athletes. So it's no longer simply a device that's used for those that are injured, but also it could easily be used for injury prevention, and again, just training at a higher level for better performance. Again, we can go really deep into all these applications, but for today I just wanted to kind of expand your mind into thinking of all the different uses that the treadmill can be used for, a variety of clinics, a variety of settings, and a variety of applications. We do have a ton of case studies and videos and webinars on our website under the clinical section that can really start to give you a little bit more detail into how these patient populations can benefit from the technology. So let's start getting on the machine. What we're going to do first is talk about the shorts. The shorts come in a variety of sizes, all the way from XXX all up to quadruple XL. So there really isn't a patient that can't fit into the shorts. And the outliers of that, we have ways to work around that. The shorts should be snug, but not overly tight. They're made out of just a neoprene fabric, and they're to be worn over athletic shorts or some other apparel. It's important to, especially in these times, to just quickly discuss disinfecting the shorts. They should be cleaned and disinfected. They can be cleaned between patient use simply by spraying and saturating the neoprene with various disinfectants that we have a full list of in our short cleaning guide. But some everyday household cleaners are neoprene safe, and we can always guide you on that direction. The other part is at least once a week, they should be laundered. And they get laundered in a garment bag to protect the neoprene, and then they get hung dry. So it's really important to clean between patients, again, simply spraying them and letting them just hang to air dry, and then disinfecting them at least once a week. So we'll go ahead and put these on. So you can kind of come over here. It's important when you're putting on the shorts that we're pulling from inside and not from this neoprene ring. So this can easily be punctured, so it's important that we pull from the inside. And then we're going to simply secure the Velcro to create the airtight seal. All right. So what you can see with the new model Via is that we have a low step-up height. So what used to be a higher height on our M320 unit, if you're familiar with our older unit, with this new model, we have a much lower step height, which makes it a lot easier for patients of different levels, different functional levels, to get in and out of the machine. We can still modify that. So if the 6 inches is still too high for your patient, or if they're partial weight bearing, we could put a smaller step, so that you step onto a 4-inch step and then you continue to step into the treadmill. If you're working with a patient who's in a wheelchair, you can simply do a sit to stand directly from the wheelchair. So we can pull the wheelchair up, already put the patient's feet on the treadmill, and then simply have them use the handrails to stand up. So there are a variety of ways to get patients of different levels onto the machine, and it is much easier now, again, with the lower step height. So we'll go ahead and get on in. It's important to hold on to the handrails. You have that nice support. You can also always hold on to the shorts from the inside if you want to help stabilize your patients. The shorts, again, they're snug but not overly tight, but if somebody needs extra support, you might want to pull them up a little bit higher, just so that they again are going to cover a little bit more of the trunk area and the hips, and just give them a little bit more stability. We're going to go over the technology of how the treadmill works once it starts going, but I want to get her in first so you can see that. Now, as you saw, to raise the bag, it's simply magnets that are on the underside of the rail. So all you have to do is actually just lift up the 2 sides of the bag until they snap. These are high-powered magnets, pretty strong magnets that, again, will just secure the bag up. The next part is simply zipping in. This might be the hardest part of the treadmill use. And so that tells you how easy it is to use. You're just gonna tuck in the skirt so it's inside of the bag, and then just zip all the way around. We wanna make sure that the zipper though is completely to the end, just so it creates a complete airtight seal. So we'll go ahead and get Katie zipped in. Or at least tucked in. I'm gonna have you. So really quickly, I want to show you one thing with the shorts as well. Some of these shorts you can see have 2 zippers, and some of them have only 1. This allows us to zip into the machine in a variety of ways. So you can see the shorts that Katie has on now, you see 2 zippers versus this pair I have in my hand has 1. If I wanted to zip in to the machine forward, I simply put the zipper in the front and I've got the tag in the back like a traditional donning of the shorts. If I wanted to zip my patient in so that they can face the back of the gym so that we can maybe work on integrating their visual system a little bit more if we're doing exercises, if we want to be able to use a medicine ball and do some exercises simply standing in the machine, I can simply put these shorts on backwards and put the zipper towards the back. And have them face the back of the machine, which we'll have videos on doing all of this, but just to give you an idea of the capabilities. With the 2 zippers here, we have shorts that allow you to do some lateral movements in the bag, so that you can actually turn around in the bag and do some lateral movements. So it really, the variety of shorts that we have will, again, they vary depending on what you want to be able to do with the machine. So this bar height here, I don't know if you guys can see here, but there's a handle here that unlocks and locks this frame. So unlike the previous model where we had to pull up the frame, we can actually lower or raise this frame height. And what we wanted to do ideally is we want the frame to be at the level of the greater trochanter. If your patient has a lot of trunk instability, poor trunk control, and you want to stabilize them a little bit more, they could potentially have a lower back injury. Maybe they have a really weak core, so they kind of fall into a little bit more of lumbar extension. If that's the case, put the frame up a little bit higher, so closer to the level of the iliac crest. That's just going to give them more support than having it lower. If you have somebody that wants to work on some speed training, they want to incorporate some nice arm swing, you can keep this frame a little bit lower, a little lower than the greater trochanter. So it all is really depends on the goals of why you're using it. So once you're in position, you're simply going to lock the handle and then we're ready to go. Our software now basically takes you through what to do next. So simply all we're going to do is press start session and then it'll allow us to start calibrating the machine. What we're going to see happen is this bag is going to start inflating. So let's take this time to talk about the technology that allows us to unweight patients. What AlterG uses is we are the only body weight support system that uses differential air pressure technology. And the calibration is very specific to how we do this. The differential pressure technology, what that means is that there's more air inside of the bag than outside of the bag. And that differential air pressure is what allows us to unweight somebody inside of the machine. So the pressure inside of the bag is going to be greater than the pressure outside of it, and then we're going to be able to control that amount of pressure to dictate how much body weight support we want to provide. The AlterG is the only body weight system that accurately measures each user each time they actually use the treadmill. So then we know when we're calibrating, it's precise to your patient's weight, your patient's height, and it's going to be consistent every single session. So there's not one time that you're going to get on the machine and not have it calibrated specifically to the user weight. The load cells underneath the treadmill are going to, again, calibrate specifically the user's weight first, so that when we know that we're removing 20% of that patient's body weight, we're actually removing 20% of your body weight. We're not making an assumption, and it's not a range. And that's really important when we talk about individuals who are recovering from surgery or injury, where we really need that specificity of unweighting. So by pressing calibration, all we need the user to do is simply stand there with full body weight through their lower extremities. We ask that the patient try not to move too much, try not to support themselves on the rails, because that's going to create some unweighting, and we really want the accuracy to be there. So sometimes we tell the patient to cross their arms across their chest and simply press start session. It'll bring me to a little checklist, and I'm just going to tell it to start calibration. And you'll see the bag start to fill with air. So what it's going to do, it's going to inflate with air, basically to the max capacity that it's allowed, it's able to unweight this specific user, and then it'll bring it back to 100%. While it's doing that, I'll just point out too that there are still markers on the side stanchions that allow you to mark the positioning of the frame per patient for that consistency of treatment. So should somebody else start to see your patient, they can set up the treadmill with the exact parameters and the exact height, the exact short size to replicate those treatment sessions, session to session. So right now, it'll say it's building the calibration curve. Again, it's going to do this for every single user every time you use the device. Now that you see the bag kind of start to deflate a little bit, it's returning the user back to 100% of their body weight. If you have somebody that is a fall risk, you're going to want to start the session right away and remove enough body weight so that there's in a fall safe environment. That's one of the key features to the AlterG treadmill, is that you can't fall in it. So aside from the precision and accuracy of unweighting, you actually also have a fall safe environment that allows you to practice balance exercises or higher level activities with patients who are at fall risk. If we did it over ground with them, we might be holding on to them a little bit too tight. We might be providing a little bit too much protective measures. But on the treadmill, because we can unweight them and create this nice fall-safe environment, we can practice these activities better or in a higher level way and allow them to start to develop their own balance reactions. All right. So calibration's complete, so we're going to start the session. Once I press start session, I can now change any parameters that I want. I'm going to start by unweighting Katie so that she's in a fall safe environment. Again, one of the key features of the AlterG is that I can unweight in 1% increments, so I can be so specific when I'm unloading or progressively loading a patient. Once I have her in a nice fall safe environment, I can start the treadmill. I can either start working on walking, I can start running, we can start doing exercises with the treadmill off. Here's where the capabilities for treatment are really up to you, the clinician, and what your goals are for using it. We're just going to have her start walking just so you can, again, see it in use. So our machines do allow you to make small incremental changes to speed, to the body weight in 1%. And this allows you, again, to work with a lower level patient who maybe just, 0.1, 0.2 change miles per hour in walking speed could mean a lot for them. So there's not going to be huge jumps in speed. It does give you the capabilities of doing it in small increments. Ideally, we don't want to remove too much body weight. You just want to remove enough body weight where their gait improves closer to normal. So if you have somebody who has an antalgic gait because of pain from, again, maybe a post-injury, post-surgery, osteoarthritis, and they have a decreased symmetrical gait pattern as a result of that, you just want to unweight until their gait symmetry starts to improve. If we start to unweight too much, we're never gonna, the goal is to get them to walk over ground. So we want to simply progressively load them as they start to improve so that eventually we can get back to over ground. It really is just a modality, a training tool to allow us to get to that next step. Some of our machines also have the capability to go in reverse and incline. So it really depends on which model that you're purchasing and with which features you feel you would benefit from in treating your patients. We'll talk about the video monitoring system. For those machines that come with the video monitoring feature, there's a button called that says video on the screen. If you press that button, there's an integrated front camera in the bag that gives you an anterior view while the patient is walking or running. It's really great for the patient to look at this image and to start to use that with some intrinsic feedback, right, to make some changes to their walking pattern. Maybe their base of support is very narrow. Maybe you want them to take a little bit wider stance. Really, it depends on what you're working on with your patient, but that visual feedback is a great way for them to start to see how they're walking. Since it's a little bit hard to look down, it also encourages a nice upright trunk, a nice upright posture, since they're going to be looking at the screen and not looking down at their feet. So again, just pressing video on the screen allows you to just open up the camera and see the patient walking. I want to explain a little bit about StrideSmart software while we're talking about all the technology and features of the treadmill. The StrideSmart is our gait analysis software that allows us to see the direct effects of body weight support, speed, incline, duration, all the various parameters. It allows us to see those direct effects on a patient's symmetry. We've chosen to look at temporal spatial parameters of gait. And this is because we're using load cells underneath the treadmill to gather that data. So all these measures are going to be measures of stance. There's going to have to be obviously weight bearing through the treadmill to be able to get these measures. On the screen, you can see these numbers changing live. They're about an average of 6 steps, 3 steps per each foot, and the numbers are changing. So again, this is some really great feedback for your patient to use while they're running or walking, and to be able to see how symmetrical their gait is. So the 4 parameters are weight bearing percentage. So it'll give you a percentage of weight bearing on the left versus the right. So again, we would love it to be equal, but none of us are perfect 50-50. But it's really nice for your patient to work to get as close to 50-50 as they can. We can look at cadence, we can look at step length, and we look at stance time. So each of these parameters we can really kind of do a deep dive into and talk about the features or the benefits of all these different parameters. For instance, cadence is great for our runners. It's a predictor of injury. If cadence is too slow, your stride can be too long, and that can cause knee injuries, right? So all these overuse injuries, there's various ways we can use these parameters to really help our patients to maximize outcomes or to just give them some feedback. At any point while my patient is walking, I can actually record and take a snapshot of their symmetry with certain parameters. So right now I have Katie walking at 84% of her body weight, and she's walking at 2.3 miles per hour. I can reduce her body weight, let's say to 75%, and I can click record gait data. And at the end of my session, I'll be able to compare and contrast how her symmetry is affected by changes in her body weight, by changes in her speed, or changes in incline. And this is really interesting for us to be able to make, to justify further treatment or why we're using the treadmill. So if her symmetry is greatly affected by increasing, progressively reloading her weight. So if her symmetry is pretty good now at 75%, but when I put her at 85% or 90% of her body weight, her symmetry starts to favor one side again. I know that there's a weakness there, but that she requires the body weight support to be able to walk more symmetrically. So make some adjustments here. And we'll do record. The other benefit is that I can create the perfect practice condition for my patient. So I always get asked, what's the right amount of body weight that I should have my patient walk at? And there's really no right answer for that. For every patient, for every goal that you're using the treadmill for, the amount of body weight is going to vary. But now I can see that direct effect of body weight on my patient's symmetry. So when I get the parameters to a point where I really like their walking and their symmetry looks the closest to normal, I can have them practice at those set of parameters, and I can replicate those parameters next time. If she came back to the clinic 2 visits from now and she was able to achieve that same symmetrical gait at a lower amount of body weight support or at a faster speed, I can also now show direct improvement. I can actually make a case to justify maybe why she's not ready to go back on the field or ready to start walking or doing training over ground. So these gait analysis parameters can really benefit you, not only the patient from having that feedback to make their own changes, it can help you justify why you're using the treadmill or why it's effective for your patient, and then it can also help you create that perfect practice condition so that you can have that higher level activity and that really a lot of gait retraining and practice with the parameters that you know are actually achieving the best symmetrical gait for your patient. All right, so we're going to re-weight her. So I know you can't see the software right now, but we will have videos that are kind of follow this one, which with a direct screen shot of the StrideSmart software, so you can see all the different capabilities of the software. But just keep in mind what the features are and the benefits of having that gait analysis coupled with the body weight support. There are two more features that we can activate when we're simply walking and looking at the parameters. One of them is crossover gait. So if you do have a patient with a really narrow base of support or scissoring, if they truly are scissoring and have a scissoring gait, you can click on crossover gait, and it's just going to have the load cells be a little bit more accurate in the data that they pick up. We do have a feature called running mode. So if you press running mode, it should help you with the accuracy of the analysis and the metrics coming through. But something to consider is if you are running, you're spending less time in stance, right, and more flight time. So those load cells are only getting a little bit of feedback. So the data is not going to be as accurate as when we're walking. The data really is most accurate when we're walking with a fairly low level of body weight support. If I unweight a patient and I remove 80% of their body weight, again, the level of impact on the treadmill is close to none at that point. So again, those load cells aren't going to be getting all that strong data to give us some nice accurate measures. So just keep that in mind when you are using the software, that if you're unweighting too much, or if you're running at a really fast pace, the load cells aren't going to get as much information, and therefore the accuracy won't be as accurate as, you know, traditional walking at a normal gait speed. The other feature that can really be beneficial for your clinic is the pain recording feature. So if I press pain on the left side of the screen, I'll actually be, there'll be a pop-up screen with a numeric scale as well as the emotions. So the facial pictures, the face icons, and the numbers will all pop up, and the patient can record their pain. This is a really nice way, again, to see at what level of body weight support your patient has the most pain, or they can tolerate with a normal amount or decreased amount of pain. So at any point throughout the session, you can press pain, have your patient record their pain level, and the machine will automatically record those levels. At the end of the session, you'll be able to see at what body weight percentage, what speed, and at what point in their walking, so maybe it's after 5 minutes, maybe it's after 8 minutes, that their pain was the lowest. And it'll be graphed out on 3 separate graphs. So that'll allow you, again, to be able to tell a physician or report back and say, Katie's only able, her pain shoots up to a 6 when she walks at 80% body weight, but at 70% body weight, her pain was down to a 4. Again, it's going to justify why they still need that body weight support to be able to have pain-free mobility. So really great feature, again, for that justification of treatment. So before I stop Katie from using the machine, I'm going to show you some exercises that can be done and how to perform exercises without the treadmill belt going. So right now we have the treadmill running, she's walking, she's working on her walking. At any point I can press the pause button. So it's a key thing is to press pause and not stop. When I press the pause button, the treadmill belt has stopped, but the body weight support remains intact. So I can still, at this point, adjust the body weight percentage without having the treadmill belt running. This is great for a few reasons. Your patient can now take a break, so I can bump up the body weight support. So I can take her down to 70, 60% body weight or more, and just kind of let her sit in the shorts a little bit. Remember, it's a fall-safe environment, so not only will the shorts help her just to be able to sit into the bag, but the body weight support will too. So you can go ahead and just kind of sit in a little bit. So it's a great way if your patient now has kind of overexerted themselves a little bit. You have them walking, they're walking without pain, they're loving it, so they're walking longer than they typically do, but they might need a little bit of a break before they have to get out of the bag. This is one thing you can do, just press pause, bump up the body weight support, and let them kind of just give their legs a little bit of a break. The other thing that you can do is use this feature to be able to do exercises. So whether it be closed chain kinetic exercises, some balance exercises, stuff for agility, strengthening, plyometrics. We can do a ton of exercises using the AlterG treadmill with or without the treadmill belt running. Again, we have a lot of resources coming for you that you can see various exercises you can do, but we'll just show you a few here. So I'm going to just put her body weight, make it a little bit more comfortable for you. All right. So simple strengthening activities like squats are going to, again, reduce the load on the joint and actually help that eccentric movement. Remember that our cardiovascular system works harder with eccentric exercise. So if we need some of this body weight support to make that exercise a little bit easier, so maybe somebody can't do any of them over grounds, or maybe 2 or 3 and then their form starts to be off, they might be at risk for injury or for falls. Within the treadmill, they can do these really important strengthening activities with a fall-safe environment and using that body weight support for a little bit of assistance to be able to do more of them. Split squats, weight shifts, just general weight shifts. I'm just going to have Katie do a bunch of exercises now. Just a simple lateral weight shift. Maybe it's utilizing the StrideSmart software to look at the percentage of weight left versus right, so that the individual, again, the patient can see the percentage increase when they truly shift their weight onto their right leg versus their left. You could do a lot of single leg stance. If we were to put her back to 100% body weight, I can actually unzip the bag without having to recalibrate. And I can put in a balance disc, a piece of foam to really work on proprioception. So we can do single leg stance on a foam block. We can use that same block to do heel raises. Maybe you have somebody recovering from an Achilles injury or surgery. The various therapeutic exercises, strengthening exercises, agility exercises that can be done here. Again, utilize the StrideSmart feature to give you some input while these exercises are being performed. But even if you don't have the software, you can always do these exercises again. Just don't turn on the treadmill belt or you press pause in the middle of a workout and use the fall-safe environment, the body weight support to do so. All right. So when you're finished with your session, you can simply press stop. When I press stop versus pause, though, it's important to remember that the body weight support will now go back to 100%. You can see the bag starting to deflate, as well as have the treadmill belt stop. So at this point, if your patient is fatigued, make sure that they hold on to the handrail so that they do have that support. But all we're going to do now is just unzip. All the way around. And then we can lower the 2 sides of the bag, again, just kind of by, there are handles here. But just pulling down. Have your patient turn around. Again, use the handrails for support as needed and step right off the bag. There is no area of the treadmill bag that can't be stepped on, so they can step directly onto the hard part of the bag as they come off of the treadmill. So really easy to get on and off. So many more things we can cover, but today we really just wanted to give you kind of a nice overview of the features and benefits of the treadmill, especially finally using our new model. The V and the Fit, again, are the 2 kind of frames that look like this, that are very similar. Again, it's all about the features, the speed, incline, capabilities of the models that vary, and the patient populations that you might use those features with. Again, we hope to bring you so much more content. We've had some really great guest speakers doing some really targeted webinars with specific athlete populations, and we want to still bring you more of those and hopefully bring you more live virtual in-services too. But I want to leave a few minutes for any questions and answers that may have come up. I'm going to just take a look here to see if there's any. But if not, I can unmute everybody and feel free to type them in or let us know if you have a question now that we can answer right in front of the machine. All right, well, again, we're gonna have this recording. So if there's any part that you missed, or if you have staff that you wanna kind of introduce, again, show them a little overview of how the treadmill works, we will be sending out the link to the recording. If you go on our website under the clinical section, you can see all previous webinars that we've had. You can look at case studies. Our clinical summary reviews tons of research in various different areas done by facilities all over the world, looking at different aspects of using the treadmill. And please feel free to reach out. All of our contact information can be found on our website, and we hope to see you again at some other either virtual in-services or webinars soon. Thanks so much for joining us today, and we'll see you again. Thanks.